Hey there, and welcome to another Health Essentials podcast. I'm John Horton, your host. Alcohol consumption continues to drop as more people view it as a negative for their overall health. In many instances, though, they're trading that vice for another, marijuana. This so-called California sober approach has gained in popularity as cannabis has become more legalized and even viewed as a wellness product. But is trading one mind-altering substance for another really a step forward? We're going to explore that today with addiction psychiatrist Jared Harp. Dr. Harp is one of the many experts at Cleveland Clinic who visit us weekly to break down health trends. So with that, let's see if there's an actual benefit to going Cali sober, or if those talking it up are just blowing smoke. Welcome back to the podcast, Dr. Harp. Thanks for stopping by to talk shop.
Thank you so much for having me back. I really appreciate it. Happy to chat about this and looking forward to our conversation.
Well, I am too. And I have to tell you, it's not often that researching a topic involves queuing up tunes. But in looking into California Sober, it definitely called for a playlist. You gotta love that there's a Billy Strings and Willie Nelson collaboration that you can use when you're studying up on this.
It doesn't get much better than that. I gotta agree with you there.
Right. I mean, it definitely made kind of getting ready for this a little more entertaining. But it also kind of shows that pop culture has really helped push this concept of California sober into the public consciousness.
That's very true. It's very, very true. This is a concept that has had kind of a niche home in some of the recovery communities, as the name implies, predominantly out west. But then as Billy Strings and Willie Nelson and a couple of other folks have introduced it into the public consciousness, it really has spread. And it's a term that, frankly, I hear quite often in my work.
Well, so aside from being an inspiration for a song, what exactly is California Sober?
So essentially, it's an alternative to the traditional sobriety model. The traditional sobriety model being no substances. And this is more of a selective sobriety model in which generally no alcohol, no hard drugs, things like opioids, cocaine, amphetamines, but then generally continued use of cannabis.
So you're just kind of picking the one that you think might not be as bad as some of the others.
I think you're really getting at a crux of this concept, and that's this is at its core really kind of a harm reduction approach. You know, as we've kind of talked about in some of our previous conversations, many substances of abuse have consequences that are very, very obvious and devastating. And cannabis, although it has consequences, sometimes they're not as obvious, and it can feel like, a lesser risky approach. So it reduces the risk of compared to what they're possibly doing before.
Yeah. What's kind of the reasoning people use to try to go this route as opposed to just, kind of going the sobriety route?
I think that there can be a number of different reasons. I think that the harm reduction approach is probably a big part of it. It's hard to function. It's hard to do the things that you want to do using some of the other substances that we were discussing. I think many times people feel as though they're able to function and they're able to be a productive member, of society and do the things they want to do while using cannabis, where they might not have been able to do it with other substances. And it's kind of a middle road approach. It's hard, a lot of times you're working with people, we're talking with folks 20s, 30 years old, to hear you can never use a substance again, 50, 60 years. That can be hard.
It's a little difficult.
That's pretty sudden. You're driving down the highway going 75 and you slow down to 65, not too big of a deal. You hit a wall, that's a pretty sudden stop.
Yeah. Now you brought up the term like harm reduction approach a few times. I just want to make sure we kind of clarify to folks what that means.
Yeah. At its heart, it's just a way of, can we make this safer, even if it's not perfect? So it can look like things, like providing fentanyl test strips to people who use substances, that where they can test their supply to at least make sure doesn't have fentanyl, or other needle exchange programs, which are a little bit more controversial, but people who use IV drugs may be provided clean needles to at least reduce their risk of infection from using dural needle supplies. So it's kind of this acknowledgement that although stopping all substances might be the ideal outcome for many people, it's sometimes not realistic to approach that suddenly. And we need to do whatever we can right now to reduce the risk.
Yeah. It sounds like it's kind of a lesser of the evils sort of way of going at it.
I think that's really the truth of it. It's the old saying about, perfection being the enemy of good.
So if someone's going to adopt a California sober approach and kind of embrace that lifestyle, are there potential benefits to kind of going that route?
Yeah. I think the most obvious benefit is the one that we've touched on a few times, in that it may allow them to step away from a potentially more urgently dangerous substance to something that is a little bit less urgently, consequential. Uh, and I think possibly the most important part is that it allows people to have some control and freedom in guiding their recovery. I think, like we had discussed before, if someone says to you, no more use of any substances, that's not a very high agency situation to be in yourself, to feel like you have no choices, no freedom, no flexibility.
Yeah,
This
nobody
allows
likes hearing the never word. Is just not very
Yeah,
appealing.
it really is not. I mean, no is bad enough, but never, my goodness. Yeah, that's a challenge.
Do you find like do people use California sober for a certain substance, or can it be for anything?
It could really be for anything. In general, it would be for those substances that are a little bit, the quote unquote hard substances, as people refer to them, which would be opioids, amphetamines and things like that. But also for alcohol, which is certainly a substance that causes, millions of dollars in health consequences and numerous years of life lost, across our nation. So it could really be any substance. So
So, but it sounds like the whole notion is that by kind of making this decision that I'm going to give up these other substances and just use this one, you can maybe kind of control how you're using it and maybe make your use better, kind of over time.
yeah, and I think people do view it that way. Some people view it as a stepping stone to maybe the more traditional sobriety approaches. It's just a little bit less of an urgent, sudden stop of things, and allows you to kind of slowly kind of transition into sobriety. And sometimes people view it as more of a sustainable solution. They may not feel it's kind of like dieting. Many times people may be able to restrict their calories to 1,200 calories a day or whatever, and try to lose some weight. But is that a sustainable approach? That could be challenging. So this allows a little bit more of some flexibility, especially in the early sobriety.
Yeah. Well, and I'm guessing too, it becomes an issue of how you're using cannabis when you sub it in. If you're using these other drugs because you have problems in your life and this is your coping mechanism, and imagine just switching to a different mind altering substance doesn't really help.
Indeed. I mean, you're exactly right. And that is the core of the problem. I mean, while there could be some benefits to using California sobriety, ultimately, as we've discussed on previous conversations, cannabis is a drug that is also has addictive potential. It also can have some consequences in people's lives that are very real. And, it can be a risk that when you try to switch to cannabis, that you develop a risk for cannabis, problems. There's even some research that suggests that it may increase your risk of returning to the original substance too.
Oh, wow. Which does not seem like definitely not the solution, not the thing you want out of that.
Right. Yeah, you're right. And I think it really represents what you were getting at earlier, in that you're still using a substance that's triggering a lot of those same spots in your brain. It's still kind of stimulating and giving energy to that addictive pathway that we've talked about in some of our previous conversations.
Well, and I've seen a lot too where they say if you're going to do this, the whole goal is to use cannabis, have moderate use, and moderate is one of those words that really it's kind of in the eye of the beholder, like what that means. Is that kind of one of the trouble spots when you're doing this?
Yeah, it is. And you're right. I mean, moderate can mean different things to different people. And I think when people are using moderate, the term, I think the spirit of what they're getting at is controlled low frequency use. And what we see often in people who have struggles with cannabis or other substance use is the opposite of that, kind of that loss of control and that kind of spiraling and increase in use that can be characteristic.
Yeah. Is the Cali Sober approach backed by any sort of research that says, hey, this might be able to work for you?
Not in any real strong or consistent way. Unfortunately, most of the existing research literature actually suggests that it may not be very beneficial long term, and like I alluded to earlier, it may actually have worse consequences for some people.
It sounds like you're just trading one slippery slope for another one.
Indeed. Folks who may have some struggles with some substance use, it's not that they are at risk of necessarily having struggles with every substance on the planet, but they are at slightly increase of developing, unhealthy habits with other substances too. So it does make it a challenge that when you're stopping one substance and trying to sub it in for another addictive substance, there's a decent chance you might end up with another struggle with that substance too.
And this gets to the whole heart of use disorders. I know that we talked about the last time you were with us, just that when people kind of lean on one of these substances to just kind of, dull the pain or fill a hole in their life, that's the bigger problem there. And it's like, you have to solve that, beyond anything else.
You're exactly right. And that's where it all boils down to. I mean, substances are rarely going to be, or essentially never going to be, the solution for what you're hoping them to be. Oftentimes if you have struggles with anxiety, struggles with sleep, struggles with depression, use of substances is often not going to accomplish, what you hope it to. You really have to address those underlying issues in healthier ways, develop healthy coping strategies, which can be attained through therapy, attained through, personal development and work. And it's a challenge, but it's really an honest self-evaluation that ends up.
So it sounds like most of this California Sober approach is more anecdotal than anything. And obviously in entertainment, as we've discussed. If somebody's going to think about doing it, they're deciding, hey, is this a route I want to take? What should they consider before they take that step?
I think it's really an honest self-assessment is what should be considered, and we talk a lot about this. It comes up a lot in addiction conversations. It's these 4 C's of addiction. We talked about it last time, but taking an honest inventory of your history of using substances, and if there was any history of losing control, having strong cravings or urges, having a lot of consequences of your use, having compulsive use where you're using when you don't even really want to. That's a sign that you may develop a struggle with even marijuana. So really taking an assessment of yourself and your previous relationship with substances can help guide, if this might be a reasonable or realistic approach for you.
So bottom line, Dr. Harp, is going California Sober something that you would ever recommend?
It heavily depends on the individual, but I would approach it very, very cautiously. It's, if you have maybe a mild or very situational substance struggle, it could potentially be an option for you. But those who may have more severe consequences, severe struggles with substance use, it's more likely to cause more harm than good.
That's pretty rock solid advice there. And I think if anyone's looking at doing this, it sounds like it's something they should really think twice about. And more, if you see a problem or think that you have a problem with one substance, maybe it's time to kind of reach out and get some help to deal with that before just trading it in for a different one.
I think that's well said. I think that's about as good as you could put it.
Well, heck, I don't want to steal your thunder there. So you've obviously taught me very well during these podcasts. So I feel like I've gained a lot of knowledge here. And hopefully through these conversations, other people have too. So this is why we always invite you on, and why we'll definitely have you back. So thanks again for coming in.
Always happy to be here. Thanks so much for the good conversation, John.
Substance use is a complicated issue, and substituting one vice for another as a kind of treatment can be tricky. If If you're concerned about your consumption of alcohol or any other drug, talk with someone about what might be the healthiest option for you as you work towards sobriety. If you liked what you heard today, please hit the subscribe button or leave a comment to share your thoughts. Until next time, be well.